You know, much of the talk on healthcare reform has been about a public option.
Some say it's critical that Washington does something about the shortage of family doctors. And tonight, the I-Team investigates just how bad the shortage is and what it means to all of us.
Well, hi. Hey, how are you doing?
Dr. Matt Johnson is back in med school. The former family doctor is now studying to be a specialist, a cardiologist. He says the hours he used to work led him to have a change of heart.
10 hours in the clinic and 2 or 3 hours in the hospital each day. Plus, there's many nights you go home and have 4 or 5 hours of dictation to do.
That was Johnson's life as a primary care physician in North Platte. He's just one of many turning away from primary care. The American Academy of Family Physicians says we're on pace to have a shortage of 40,000 family doctors in the next 10 years. By some estimates, that shortage could hit 160,000 by 2025. So what's that mean for you and me?
Well, because of the shortage, access is an issue.
Dr. Rubens Pamies at the University of Nebraska Medical Center says that shortage means longer wait times for people to see their primary care physicians. And in some cases, people won't or can't wait, so they go to a hospital's emergency room.
And of course, going to the emergency room comes at a much higher cost than it would be if you had gone to a private doctor.
So why aren't more students going into family practice? Well, one doctor tells me the amount of paperwork required by insurance now is ridiculous. But most of the reasons have to deal with money. The average debt after medical school is $129,000. And primary care physicians make a lot less than specialists.
Specialists make 2 or 3 times as much with only a year or 2 more training. Well, if you're a medical student with $200,000 in student loans, it makes it a pretty tough decision not to go into family medicine. And
Dr. Bob Ronner is president of the Nebraska Academy of Family Physicians. He says the payment system needs to be changed so doctors aren't paid by the number of procedures that are ordered. They're paid by the quality of care.
And the payment has to do with how good a job you do, just not how fast you can run patients through your office. It makes the patients happier, it makes us happier, and it tends to produce better quality care at a lower cost.
Leveling the payment playing field, experts say, will help attract more potential family doctors to med school. So will more tuition assistance or loan forgiveness programs for primary care students.
Take a quick look here.
Experts say something needs to change, and soon, or more doctors like Matt Johnson will keep leaving primary care, and everybody, doctors and patients, will suffer.
You could see 30 patients a day, every day for 6 days a week and still be 6 weeks to your nearest appointment. There's that much need, for medicine out there.
Now in Washington, some of the proposals do provide bonuses for family doctors and to aid teaching hospitals that focus on primary care education. Experts say if everybody is required to have health insurance someday, more doctors will be needed to see them.